If you have knee arthritis, one of the most frustrating parts is that your knee may not behave the same way every day. Sometimes the knee feels stiff when you first stand up. Sometimes it swells after you do a little too much. Sometimes you wonder if every painful step is making the arthritis worse. And that leads to one of the biggest questions people have. Am I damaging my knee every time it hurts? The answer is not necessarily. A better way to think about your knee arthritis is this. Your symptoms are not just damage alarms, they are signals. And if you know how to read those signals, you can make better decisions with walking, stairs, exercise, rest, and flare-ups. As a physical therapist who specializes in orthopedic conditions, one of the biggest mistakes I see is people judging their knee only by how much it hurts in the moment. But a smarter recovery comes from asking a better question. How did my knee respond afterwards? Most people hear arthritis and think, my cartilage is worn down. And cartilage does matter, but knee arthritis is not only a cartilage problem. It can involve the whole joint system. Cartilage changes, irritation of joint lining, swelling, bone changes, meniscus changes, stiffness, muscle strength, balance, walking tolerance, and the way you move with stairs, squats, chairs, and daily activity. That is why two people can have similar x-rays and completely different symptoms. One person may be told they have severe arthritis and still function reasonably well. Another person may have less severe imaging, but more pain, swelling, and limitation. So yes, the x-ray does matter, but the x-ray does not automatically tell us how much walking your knee can tolerate today. It does not tell us how many stairs are too many. It does not tell us whether squats are a good starting point or too aggressive exercises right now. That is where the real decision-making starts. Knee arthritis pain often shows up when the demand on the knee is higher than what the knee can currently tolerate. But here is the important part. That does not automatically mean those activities are bad. It often means your knee needs a better dose. You want enough activity to build capacity, but not so much that your knee starts to get irritated for days after. The goal is not perfect rest. The goal is repeatable work your knee can recover from. Now let's talk about stiffness. A lot of people with knee arthritis say, my knee feels stiff when I first get up, or it takes a few steps to loosen up, or I feel tighter the morning after I did more. That stiffness can happen for a few reasons. The knee may not be moving through its full range as often. There may be mild swelling creating pressure inside the joint, or the muscles around the knee may be guarding because the joint feels irritated. But stiffness does not automatically mean your knee is getting worse. One useful distinction is this. If the knee feels stiff at first but improves after a few minutes of easy movement, I usually treat that differently than stiffness that gets worse the more you move. Stiffness that loosens up may respond well to gentle motion. Stiffness that gets worse, especially with swelling or limping, usually means the knee is more irritated and needs the plan adjusted. So if the knee is stiff, the answer is usually not aggressive stretching or total rest. A better first move is gentle motion. Easy knee bends, short walking bouts, little cycling if tolerated, heel slides, or simple knee straightening work. Swelling is one of the most useful signals with knee arthritis. A swollen knee might feel tight, puffy, warm, heavy, hard to bend, harder to straighten, or less trustworthy with stairs. Swelling is often your knee's way of saying, that was more than I was ready for. That does not always mean you caused new damage, but it does mean you should probably respond. Here is the part people often miss. Swelling can also change how the muscles around the knee work. When the knee is irritated or swollen, the quadriceps may not activate as well. So if your knee feels weaker, shakier, or harder to control after a flare-up, it is not always because you suddenly lost strength overnight. It may be because the joint is irritated and the system is not letting the muscles work normally. That is why I take swelling more seriously than mild soreness. Mild discomfort during activity may be acceptable if it settles. But swelling later that day, more limping, or much worse stiffness the next morning usually tells me that total dose was too high. Pain gets my attention, swelling changes the plan. Here is the most practical thing I want you to take away from this video. Use the 24-hour response rule. After walking, stairs, exercise, yard work, or any activity, ask, how does my knee feel later that day and the next morning? Do not judge only what happens during the activity, look at the full response. If you had mild discomfort during the activity, but the knee settled down and felt normal the next morning, that was probably an okay dose. If your pain clearly increased, your knee swelled and you were limping more, or the knee felt much stiffer the next morning, the dose was probably too high. But that does not mean the activity is forbidden, it means you need to modify it. That is smarter recovery. You are not resting every time it hurts, you are not blindly pushing through it either. You are using the knee's response to choose the next step. So here is the simple framework. After activity, your knee response usually tells you to do one of three things: repeat, progress, or modify. If you had mild discomfort but no swelling, no limp, and the knee felt normal the next morning, repeat the dose. You may even be able to progress slightly if it has gone well a few times. If the knee was a little more sore but settled by the next day, that may be a borderline dose. I would usually repeat the same amount before increasing though. Now, if your knee swelled, you limped more, stairs were worse later, or the next morning was clearly much more uncomfortable, you need to modify, but don't quit. This is how you stop guessing. You use the response to make the next decision. So when your knee hurts, stiffens, or swells, think in this order: calm it down, keep it moving, rebuild, progress. Calm it down by temporarily reducing the clear irritator. That may mean shorter walks, fewer stairs, less kneeling, less squatting, or backing off an exercise that was too aggressive. Keep it moving with gentle motion that does not flare the knee. That might be easy knee bends, shorter walks, heel slides, light cycling, or simple mobility work. Then rebuild. This is where strengthening matters. The quads matter, the hips matter, the calves matter, balance matters, walking tolerance matters. Exercise is one of the best supportive tools we have for knee arthritis, but that does not mean every exercise is right for every person on day one. So the goal is not to copy someone else's exercise list. The goal is to find a starting point your knee can tolerate, repeat, recover from, and gradually progress. That is clearer rehab, that is smarter recovery. If you want help putting this together, I created a free knee arthritis roadmap that walks through how to think about pain, stiffness, swelling, walking, stairs, exercises, and flare-ups. You can find that link below along with the full knee arthritis article library on Therapeutic Edge.